Growth factors are small proteins produced by multiple cells and act as signals to allow cells to communicate with one another. Growth factors specifically stimulate the migration and proliferation of cells, and thus the formation of new tissue. Many cell types are involved in wound healing, including platelets, macrophages, and fibroblasts. Platelets are the first cellular components to invade the wound site and initiate the wound healing process by releasing stored growth factors. One specific growth factor that is available for topical application on a well-prepared wound is a recombinant platelet-derived growth factor. Regranex gel is formulated with a 0.01% becaplermin, a recombinant human platelet-derived growth factor. An aqueous solution carboxyl methyl cellulose-based gel for topical administration. At this time, it is the only FDA-approved topical agent with PDGF. When applied to a well-prepared wound bed, Regranex gel promotes the recruitment and proliferation of chemotactic cells, thereby stimulating the wound healing process and aiding formation of granulation tissue. Regranex gel is indicated for the treatment of lower extremity diabetic ulcers and extend into the subcutaneous tissue or beyond and have an adequate blood supply. It is an adjunct to, and not a substitute for, good wound care practices and is contraindicated in patients with known neoplasms at the site of application. Additionally, malignancies distant from the site of application have been reported in both a clinical study and post-marketing use. Therefore, Regranex gel should be used with caution in patients with a known malignancy. Regranex is available by prescription only. It is applied daily in a thin layer to a clean wound bed and covered with a moist dressing. Based on the clinical trials, the package insert recommends a second dressing change daily to reapply the moist dressing. In this author's experience, the second dressing change is not necessary as long as the wound bed can remain moist. However, this is considered off-label use and must be determined by the prescriber.